Good morning, good afternoon, and good evening, wherever you are in the world. Hello and welcome to Reimagining Motion, a podcast from the High Volume Transport Applied Research Program, which is undertaking research into the complex issues around sustainable transport in Africa and South Asia. The HVT program is an £18 million investment by the Foreign Commonwealth and Development Office, FCDO, and I'm your host, Holger Dagmann. Welcome to today's show. Welcome to our sixth series that explores infrastructure and transport system development in South Asia and what it needs to look like in the future. The transport sector has long played a crucial role in Asian development, with a particular focus on increasing connectivity in South Asia to address poverty and boost economic growth. The development of transport infrastructures and systems, often focused on road transport, has led to rapid urbanization and growth, but brings its own challenges. Motor vehicle numbers from 2- and 3-wheelers to passenger cars in Asia are doubling every 6 years and becoming a major source of greenhouse gases, air pollution and congestion. At the same time, the region also carries a disproportionate burden of extreme weather events from climate change that has catastrophic impacts on infrastructure and people's lives. Today, I'm very happy to talk to Dr Deepty Jain. She is an assistant professor at the Transport Research and Injury Prevention Center at the Indian Institute of Technology, IIT in Delhi. She's an architect and planner by training with specialization in transport planning, built environment studies, social and environmental impact assessment, and special focus on marginalized groups, behavioral analysis and urban planning. She's also currently leading one of the high volume transport projects, which is called Gendered Approaches to Addressing Adaptation Capacity to Hot Weather Conditions, which we'll talk later on about. And in this episode, we will hear about work being done to assess the impact of heat waves on women when traveling in India and potential solutions. Welcome, Deepty.
Thank you.
How are you doing today?
Very well. Looking forward to the podcast.
Thank you. Thanks for taking us your time. As mentioned in the introduction, we see currently extreme heat waves in India, in particular so Delhi. Between March and May this year, 56 people were killed, and there were almost nearly 25,000 heat strokes cases in the year. And this affects in particular women and children. We also want to start to better understand in general what are making women and children particular in terms of the challenges for transport and their everyday commute. So tell us a little bit about that before we getting later into a particular case around the questions of resilience and the need for address that.
Holger, if I want to talk about what make women and children more vulnerable to the heat wave. So recently studies have started reporting on certain numbers where they are talking about that the vulnerability as well as the mortality and morbidity is higher for women as compared to men because of the heat wave. Now, why is it higher? There could be various reasons, but I would particularly focus on women as a commuters. When we look at women as a commuters, they mostly are traveling during the daytime when it is hot, and they are traveling mostly by walk. So both the time of their travel and that have an impact on their exposure to the hazards and what kind of modes that they're using. So for example, think about somebody using a car versus somebody walking. So when that somebody is using a car is traveling for the same distance but maybe spending lesser time, and is also sitting in a controlled environment, which is lesser exposed to the extreme high temperatures. But as we know that majority of the women walk, and whether they walk to work or they walk for various trip purpose, their exposure to the temperature remains as it is. So whatever is the ambient temperature, they are exposed, therefore their exposure is highest. But then we have to also look at what are their vulnerabilities. So vulnerabilities is because of their limited access to resources. For example, can they change their time of travel? Can they change their mode of travel? Are they able to change their mode of travel? So these three things come or is a function of many other things, which include safety, security, availability of transportation modes, affordability of transportation modes, how much I have to pay. And it also relates to the triple role that women have to play. So when a woman is choosing a time of day for traveling, it is bounded by many other activities, which include their role at home, their role in the society, and their role at the workplace if they are working. So this restricts their ability to change their time of travel. So for example, if a woman chooses to travel, let's say at 3 p.m. or 4 p.m., which is still very hot, can they change their time of travel to, let's say, 6 p.m. or 7 p.m.? Which may be very unlikely because they are expected to be at home so that they can actually support their family needs and take care of their family. So that's how they become more vulnerable. So not only their exposures are high, but also their vulnerabilities are very high. And then you have these multiple dimensions to be looked at, including socio-cultural norms, safety, security concerns, availability and affordability of transportation systems, and being able to afford a particular type of mode of transport other than availability.
Thank you, Deepti, for detangling those challenges, which I like the term, the triple, how did you call that? The triple challenge. Can you give us a little bit more insight from any kind of research in terms of what are the big issues for women? You mentioned about the time of travel, the mode of travel, so their role. So what is research telling us? Where is the main difference between male and female when it comes to like the commute?
This research and previous research, the research that we are doing with HVT and the research that we have conducted in the previous years, is giving us a lot of insight on the differences, the way the women travel. And I will touch upon three types of trips that they make. Women when they're traveling for work. So the study that we conducted in Visakhapatnam had shown us that majority of the women walk to work within the same income levels as compared to their male counterparts. And that tell us they are about their dependency on a particular mode of transport. Then this is another research we conducted, which was for Delhi, and we were trying to understand how different children by age, gender, and income are accessing schools. And here we found that girl child are lesser dependent on private vans. And then we went through a lot of literature why it would be happening. And then we found that safety and security concerns associated with any shared mode of transport deters parents to send their girl child to school by the private vans. And then third, the ongoing research that we are doing right now, again over here we have found that for various trip purpose, excluding work, women tend to walk more as compared to men. Now, why this would be happening? One could be the availability of resources, whether there are multiple vehicles, for example. Even if the vehicles are there, do I know how to drive? Then third, in the household itself, whether these vehicles are available. Other than vehicle availability, it could be because of public transportation systems. So can women use public transportation systems? I would say yes, but then we have to understand their nature of trips. We found that majority of the women in our data set are making trips, or I would rather term them as tours. And these tours involve multiple trip chains. So, for example, they start from home, go to school, pick up the kid, go to the shop, buy some certain stuff, then come back to home. Which would mean 3 trips. They may be short distance, let's say 1 to 2 kilometers at the maximum, each trip. But that whole tour is 3 trips. Now, if I look at the total distance traveled during that tour, will be huge. But then, because it is multiple trips, their ability to use public transportation system therefore reduces, because these kind of trip chains cannot be handled by a large scale public transportation systems. So, and then like what I said is the abilities. Do I have resources and can I afford it? So there are these multiple, types of trips that we need to look at. And then it's not only women, then we have to look into women and income. Then we have to look into women and the types of trips they are making. And then we have to understand how these trips get aligned and how the different kinds of modes are being used for the different purpose, which results in their exposure.
Thanks deeply for that. And in fact, your research and many other pieces over the last decades, in fact, shows us is the need to look into gender-specific transportation, particularly when it comes also to public transport, where often this whole system is designed more around male needs rather than also recognizing the need for trip chains, which is often related also to female parts of society here. So I'd like to go into now the work you're doing with the high volume transport, because as I said earlier in the introduction, there's not just a specific lens when it comes to women and trip chains and certain behavior and also certain preferences and opportunities, but there is also another dimension which we should also take into account, which it comes from climate change, and with that we have seen more and more extreme weather events, and it's all over the news globally. And in fact, unfortunately, also in India, with increasing amount of heat waves. So just picked up a number that is the numbers of days recording more than 44 degrees Celsius in Delhi had increased from 17 in 2019 to 31 in 22. And we here in these days really high numbers of days exposed to heat wave in this year. So what are the additional challenges for women?
We need to understand that women are making these multi-chain trips. Second, they are mostly walking. So even in the highest income group, we have found that majority of the women, around 50% of the women, walk. So it tells us something about their dependency on a particular mode of transport that is good for the environment, but is also exposing them to the harmful conditions. And then we found that after 7 p.m., their number of trips that are made by women just declines to zero. Now, why it would be happening? Again, like I said, it could be related to various reasons. One particularly could be that their need of being at home and therefore not being able to incur any additional trip after that. Second, maybe also related to the safety and security concerns, because after sunset, they are not feeling comfortable. And this is something which we have not touched upon as part of the project yet. But we are able to see that why these trips are not there after 7 p.m. or 8 p.m. It is probably because of the safety and security related concerns that may exist that deters women from traveling beyond sunset. Then we have to understand the amount of time that they are spending on roads. So in our different surveys, we found that on an average, 45 to 60 minutes, women are there on the roads, which include walking, waiting, standing, shopping, and they are exposed to the road environment, the ambient temperature conditions. Now, it leads us to various questions and also to various solutions. So one which is related to the time of day. Can I change my activities if I keep the triple role aside, but still can the infrastructure and the city allow a woman to travel comfortably after sunset or in the evening hours? Sociocultural norms is something which one may talk about, but then one need to understand a lot of complexities that may exist over there to be able to communicate about the potential solutions. But then another component is if women are spending 45 minutes to 60 minutes in the road environment during the hottest part of the day, then we need to understand what is the kind of street environment that they are exposed to. So as part of this ongoing project, we actually collected data from streets where we recorded what is the street typology, what is the type of green infrastructure, and what is the type of buildings. And we also monitored the ambient temperature conditions over there. And we found that this temperature variation during the hottest part of the day varies up to 7 to 10 degrees Celsius between different streets. Now, what could be the reason? One could be, as we know, that more green the streets are, they are more thermally comfortable. Then second is most of the streets that we collected data from are smaller lanes, which have very high building height to street width ratio, which means that the buildings are casting shades on the street for majority part of the day. Now, this is what we collected when we were looking in dry, hot weather conditions. If it gets humid as the monsoons will arrive sooner, we need to again understand that how these temperature variations and relative humidity variations are going to happen. But it does throw significant insight on whether women are exposed to a better or more thermally comfortable environment as compared to actual ambient temperature conditions of 44 degrees Celsius or more. And the research is showing that the way we design our street environment will have an impact on the environmental conditions being experienced by women.
Thank you, Deepti, and fascinating research. So I know also your project is still ongoing, but can you share a little bit of ideas also for solutions, how to improve versus the public transport system? You mentioned the design of ways. What are elements where decision makers could, based on your research and other researchers, make changes?
So I want to touch upon 4 subtopics which can be identified as potential solutions. One can be related to the infrastructure provision. Second could be operation and management of services. Third is engagement with community. And last and not the least is urban planning. And I'm not ordering them. So when we are looking at infrastructure, we are looking at provisioning of trees and green belts, shaded seating areas, water misting stations that have also emerged as one new low-cost technology that can be deployed on different streets. Operation and management over here, and specifically when we are looking at women versus men, provisioning of public transportation systems is very much necessary. But then we also need to look into paratransit systems, because these are the systems that can actually meet the demand of women, because they can serve for the short distance trips, reduce their exposure, and can also provide services on smaller lanes. So these kind of services, if they are made more affordable and accessible, then these services can actually serve the demand of women and reduce their exposures. Third is engagement with community. Women need to travel at a certain time of day because of certain needs. It may be picking up children, it may be going for buying medicines, etc. But then engagement with community can help us in identifying how community can build a role where they become an enabler and a provider. So, for example, can we think about sharing of trips? Let's say from a particular neighborhood, there are 4 parents who need to go and pick up their kids. So can there be division of roles and responsibilities? Maybe one day one parent goes and pick up all the kids. Then on second days, another parent goes and pick up all the kids. So it overall reduces the exposure on weekly basis. Last is the component of urban planning. As we know, the urban heat island effects are increasing. This is essentially because of increased usage of appliances. And there's a vicious circle. More heat, more use of appliances, and then results in more heat dissipation. Same goes with usage of cars. Now, how urban planning will play a role is in terms of controlling these temperatures. We're looking at infrastructure. We're looking at provisioning of trees and shaded areas along the streets. But urban planning has to look into building and networking the green infrastructure with the urban development such that the overall temperatures come down. And that can help in reducing the usage of appliances, and therefore heat dissipations can be controlled, and therefore the exposures can be controlled. So these are the 4 macro level strategies that we can look at. And understanding this multifaceted approach that may be required, we are trying to build upon a multidisciplinary method where we start looking into the street audits and revising those street audits that can become a tool for urban planner, transportation planner, and engineers to study the street environment and whether they are not only providing a safe and comfortable, but safe and thermally comfortable walking experience.
Thank you, Deepti. And very interesting when you describe the 4 buckets of, let me call that in terms of potential solutions on the infrastructure side, on the operational side, on the engagement of the commute, as well as the users experience. Can you give us any good example out of India which you came across around these 4 areas?
A lot of cities and states have started building their heat action plans. But for commuters particularly, the authorities have been a bit silent. Now, one of the reasons could be that these heat action plans are identifying 2 types of authorities who take primary role. One is the healthcare specialist or medical officers, and second is related to the municipal corporation. Now, municipal corporation can talk about larger urban planning agenda. They tend to talk about the kinds of alert to raise awareness amongst the people so that they can avoid commute and they can avoid their exposure during heat waves. And same goes with medical practitioners and health experts who are talking about the different kinds of strategies like keeping cells hydrated. These strategies can help people in addressing heat wave, and what is the capacity building that is required by the medical practitioners so that they can address if people are exposed to heat strokes and keep the records. But I haven't seen any targeted effort which is looking at reducing the impact of heat wave on commuters. Let's not even talk about women as the commuters. One of the heat wave action plan that I happened to touch upon was of Odisha, and they did talk about transportation systems. But to my surprise, the heat wave action plan of Odisha, they were talking about reducing or restricting the usage of buses and operation of buses during the hottest part of the day. Now, that's a major concern because people still need to travel. You cannot restrict their traveling. And if people have to travel and you have also restricted the operation of buses, that means we are asking people to use alternate mode of transport. And we have to understand that in current times, the bus transport users belong to lower and middle income groups. They are not coming from affluent classes. And that would mean that they have to be dependent on walking or using paratransit systems like cycle rickshaws, where their exposure to heat wave will increase. And if we have reduced the number of bus services, that means the waiting time on the bus stops will increase. And again, that will have an impact on the exposure of commuters to the hot weather conditions. As of now, I have not been able to find any heat action plan that has really sensibly talked about addressing the impacts of hot weather conditions on commuters.
Thank you for sharing that. That leads us to the question is what needs to change also on the overall system, but also how is it to bring in a gender perspective into planning, into the question of integrated transport systems. So, and with that, we need not only to ensure that the transport caters for women's need, but there is also planned, developed, and run by women. How do you think we can achieve a shift from women's development to women-led development in India?
So, your question is itself an answer to the question, because when we are talking about women-led development, not for women development, that means that we are looking at women coming into the main workforce of transportation sector, whether it is operation planning, management. But beyond that, we need to look at integrated multimodal transportation system. And for that, we had Unified Multimodal Transportation Authority as a framework. But then it hasn't really taken off in majority of the cities that we were planning for. And why it could not be taken up? Because of divided roles and responsibilities, where Unified Multimodal Transport Authorities had lesser roles, no resources. Somehow there is an engagement between urban planning and transportation planning, which should not have happened. So even if we have, let's say, master plans in place, they are not really conversating with the transportation plans, and likewise other way around. So if safety and security concerns could be taken up even in urban planning agenda, they don't necessarily get transferred to the transportation planning agenda. When we achieve women-led development, in transportation sector. So yes, one answer is to have women taking key roles in the different sectors of transportation. But another important thing that in transportation planning, we are mostly concerned about the peak hour trips. And like I have already mentioned that almost 50 to 70% of the women are making trips during the daytime and for various purposes other than work. Now, these trips don't get reported. The trips are recorded only as trips. They are not recorded as tours. So these things lead to underreporting of women as commuters. That also came up as a challenge when we picked up this project, because a lot of people were asking us about why you are focusing on women commuters. They are not the essential workforce. They are not part of the major workforce. Now, with the help of data, we could actually talk about that how women are making more number of trips than men, which never got reported. But this is not part of our gender planning method. And that's where we need to change to be able to understand the needs, the time of day that they travel, and how much they travel, which is not getting reported anywhere. Whenever we are looking at transportation as a choice, whether it's a transport analyst, planner, engineer, or even a mode user, the general thinking behind it is that a person is making the choice between travel time saving and cost saving. So whether I can save money because I don't have money, or can I save my time and spend more? And there is this continuous debate between the two. But when it comes to women as a commuter, we have to add more dimensions to these two, you can say, factors, which include safety and security. So it may not be necessary that I am able to save money. It may not be necessary that a person is able to save time. But because of safety and security concerns, people are pushed to use a certain mode of transport. So I was actually going through one of the research papers that came from Kolkata. The paper was talking about women may continue to walk despite the provision of public transportation systems because it is not perceived as safe. So even though the exposures are high to the hot weather conditions when you're walking, even though it is going to take more time while walking as compared to using buses, but women may still continue to walk because of the safety and security concerns. So not one factor can be looked at independently in terms of what determines the choice and what therefore determines the exposure and vulnerabilities. It's a multi-dimensional, multi-factors that need to be looked at, which are related to each other, that determines their choice.
Thanks for listening to this episode. If you would like to learn more about the work of our guests or check out any of the resources mentioned, they are all linked in the episode description. I also encourage you to check out the other episodes in this series and leave us a rating, as it really helps people find our work. And finally, you can learn more about the work of HVT at our website, transport-links.com, or follow us on LinkedIn at High Volume Transport Applied Research. The HVT program is an £18 million investment by the Foreign Commonwealth and Development Office, FCDO. HVT is providing a new body of research to help inform the decisions of policymakers and planners and make road and rail transport greener, safer, and more accessible, affordable, and inclusive. My name is Holger Dugman, and you have been listening to Reimagining Motion. Goodbye and auf Wiedersehen.